SPY syndrome has a genetic link. When both people in a couple have the defective gene, each pregnancy carries with it a 1 in 4 chance that the child will be affected by SPY syndrome. It is an autosomal recessive disorder, which means that only individuals inheriting the defective gene from both parents are affected. It is very possible for children to carry a gene and not have the disorder if both parents do not have the gene. And the child will just carry the gene and possibly risk passing that along to their children in the future. Diagnosis of SPY syndrome often can be made through clinical examination and urine testing. Enzyme assays are also used to provide definitive diagnosis of SPY syndrome. Prenatal diagnosis using amniocentesis and chronic villus sampling can verify if a fetus either carries a copy of the defective gene, which would mean that they would not have the disorder but would potentially be able to pass it along to their child, or if the child is affected by the disorder can be determined by this testing. Genetic counseling can help parents who have a family history of an MPS disorder to determine if they are carrying the mutated gene that causes the disorders. Currently, there is sadly no cure for SPY syndrome. However, medical care is strictly directed at treating systemic conditions, which vary from patient to patient, as well as improving the person's quality of life with their family. The most commonly practiced treatment for children with SPY syndrome is a multidisciplinary team approach of medical consultants. And this team will just vary from patient to patient as symptoms vary for everyone. It could include a physical therapist. Most include at least a pediatrician and a genetic counselor, but it could include a wide variety of different medical folks. Also, enzyme replacement therapies are currently being tested. It has been proven useful in reducing non-neurological symptoms and pain.